such as blurry vision, cataracts, glaucoma, and retinopathy. In fact, diabetes is the leading cause of blindness among adults aged 20 to 74. And these facts were gotten from WebMD. Good afternoon, listeners. Today is World Diabetes Day. Yes, and it's crucial to recognize its importance. On today's show, we're joining the global campaign by focusing on how diabetes impacts eye health and why you should pay attention to the warning signs. This observance is particularly relevant because diabetic eye conditions are the leading cause of vision loss among working age adults. Sadly, these issues often remain undetected until serious vision loss occurs. For this reason, it's crucial for everyone, especially those with diabetes, to undergo a comprehensive eye exam at least once a year. You should know we've prepared valuable insights and practical tips on protecting and maintaining your vision while managing diabetes. So stay tuned to Eyes on the Road for all the details. Now, we want to say welcome if you're a first-time listener, and if you're a returning listener, well, we want to say we appreciate you. You're tuned in to Eyes on the Road, the program that examines one of the most delicate and vital organs in the body. I'm talking about the eyes, and this show is brought to you by Lagos Traffic Radio 96.1 FM, and of course, my name is Akan Usen. Last week, we started the discussion on diabetes and its impact on eye health, like I said, and we talked about the diabetes rates rising worldwide. Consequently, diabetes-related eye conditions are also becoming more prevalent, and this underscores the relevance and timeliness of World Diabetes Day 2024 theme, which is breaking barriers and bridging gaps. This theme highlights the critical need to address challenges faced by individuals, communities, and healthcare systems in accessing diabetes prevention and management resources. Today, we'll turn our attention to diabetic retinopathy, because I understand it's the leading cause of irreversible blindness related to diabetes. To give you an overview, diabetic retinopathy is a serious eye condition that can lead to vision loss and blindness if blood sugar levels are poorly managed. We implore you to join us on the show as we explore what diabetic retinopathy is and what its symptoms are, what the prevention strategies are, and how to manage same. On this note, welcome our doctor on the show because, of course, you know I'm not the expert. Dr. Rasheedat Aruna, Chief Optometrist at Modern Eye Foundation in Omoli Ujudubaja. After a brief break, yes, very well refreshed and looking really, really delectable. Welcome, Doctor.
Thank you very much.
Great to have you on the show with us. Okay. So, Doctor, I'm curious, are there specific blood sugar levels that increase the risk of eye complications? Now, blood sugar levels. So just take us down that route.
Yes. Good evening, listeners. Thank you for having me here again for Eyes on the Road. And our topic for today is diabetic retinopathy, just like you've introduced. And today's World Diabetes Day, and we are trying to educate you about the importance of, taking care of your health, number one, taking care of your eyes, okay? The eyes is not in isolation, all right? It's part of the body, and whatever affects the body can affect the eye. In fact, most times can affect the eye. And, the eyes, they are very small structure, so it can be easily affected. Sometimes those very serious problems, medical problems in the body, it is when you do an eye test, sometimes they are detected, and then we ask you, have you done this, go do this test, and then they come back with the results, and then you find out that it's true. So let me cite an example. I had a patient sometimes 3 months ago. He came to the clinic and told me he's experiencing blurry vision. He's experiencing some other symptoms like redness in his eyesight, itching, some other minor symptoms. Let me call it minor symptoms. So I asked him, how's your sugar level, how's your blood pressure, some other questions, vital questions, vital history we want to take note of while examining you. So upon looking at his eye, he did a comprehensive eye test, which is a very good one. Upon dilating his eye and doing a slit lamp examination of his eye, in fact, from ophthalmoscopy to slit lamp examination, I found out that on his retina, he already has what we call yellowish spots, hard exudates
What's
all
that?
over. So it is degenerative changes, damages on his retina. So I'm like, okay, these are changes that should not be there. And this patient is is in his late 30s, it's not even in his 40s. What is going on? So I had my suspicion, and I told the patient, go do so test. I added HbA1c test, which is a sugar test. So thank God, because some patients, when you try to advise them, or some people, when you try to advise them to do this, they feel it's not in my family, there's nothing wrong with me, I do this. They don't listen. They just give me glasses or give me this, let me go, which is not the best. So the patient heed to the advice. He went to do the HbA1c test, and found out that his HbA1c level was very high.
It's very high. Okay, that's how you know the sugar level.
Yes, that's how you know the sugar level. There's the sugar level in the blood. We have fasting blood sugar, we have random blood sugar, but the true test of the levels of sugar in your blood is the HbA1c test, and it was way higher than even the higher limits of normal. So we told him, okay, so you need to go see your physician at this point to manage your sugar level. So he went to see his physician. The physician told him what to do, and good for him, he had adhered to all the instruction the physician gave him. And then I told him to come back in 3 months' time. He should repeat that HbA1c test. So I think sometime last month he repeated the test, and then when he came back, the levels were very, very good, like normal. And then we checked his eye, his vision was better, and then he himself, he knew that he felt better. He now started confessing that, he used to take lots of Fanta and bread. In fact, sometimes that's his meal for months.
Okay.
So that is where
Fanta and bread.
That is his meal for a
staple meal. Okay.
So imagine you doing that for a month. All that amount of sugar and maybe some other times you even take more than one Fanta.
And it's not really very active lifestyle.
Yes, active. So he started doing exercises, started watching what he ate, started changing his lifestyle, and then he came down to normal from 8 point something to 4 point something. So I was very happy. So that's what diabetes can cause in the eye. It can affect the eye structure.
Okay.
It can lead to diabetic retinopathy. So diabetic retinopathy is a complication of chronic, constant increased sugar level.
Okay.
And if you are not controlling the sugar level properly,
yes.
Okay, we have lots. If I have lots of examples, I will give you many cases
Please
here.
do.
So that.
Meanwhile, there's a message on WhatsApp. Well done, Dr. Aruna.
Oh.
Simple. Well done, Dr. Aruna. Okay. Moving on.
Thank you, Seva. So and like you said, it's one of the leading cause of blindness in adults aged 20 to 70. In the US, it's one of the leading cause of blindness over there. So aside age-related macular degeneration, it's now like number 2 or number 3 on the list. That's to tell you how important, being able to manage, how serious it is. So it can cause irreversible vision loss. We have stages. Before I go to the stages, let me talk about the risk factor.
Okay.
One of the risk factor is, of course, one of the risk factor of diabetic retinopathy is diabetes.
Diabetes, okay.
Yes. So if you have a family history of diabetes, or you have diabetes, so you are managing your diabetes, which is very good, okay? But alongside managing your diabetes, you need to do yearly comprehensive eye examination.
Okay.
Yes, because one of the structure, apart from the other organs of the body which diabetes can affect, one of the structure it can affect is the eyes. And it is dangerous because if you start losing vision, it is irreversible. You cannot reverse the damage that sugar has done. Diabetes can cause diabetic cataract.
Wow.
It can cause glaucoma. It can cause maculopathy. It can lead to proliferative diabetic retinopathy and a whole lot of things.
Just diabetes.
Just diabetes. Just when you don't control it properly, you understand, it can cause damage on that retina at the back of the eye. So diabetes is one of the risk factor of diabetic retinopathy. Now, hypertension. If you have diabetes, you now have hypertension alongside it. Those two things, it can worsen the damage that ordinarily diabetes can cause. Now, when you have cholesterol, high cholesterol in your body system, you have high cholesterol level, it can also like triple the effect of having diabetes alone. So you now have diabetes, you now have hypertension, you now have cholesterol level. It can damage the eye to a point of you losing vision if you are not controlling those things properly. Now, age is also a risk factor.
Okay.
Of course, age is a risk factor for diabetes, and poorly controlled diabetes can cause diabetic retinopathy. Now, ethnicity, of course, we don't know. Most of the time, all these diseases, they happen to blacks. And
my question is always, why the black man? Is it because the melanin, or what exactly is the cause?
Yes, we can attribute it to what do you call it now? Melanin.
Yes.
Okay, so the pigments and some other things, some other genetic factors, in the body. Now, smoking is also a risk factor. Smoking can cause damage to the blood vessel in the eye, can lead to oxidative stress, which can damage the retina. So it's also a risk factor to exacerbate the effect of that sugar level and lead to diabetic retinopathy.
Okay.
Now, if you have kidney diseases as well, it's also a risk factor for developing diabetic
Kidney disease, okay.
Yes, kidney disease. So it is a risk factor for diabetic retinopathy. Now, what are the symptoms? What are the signs you look out for? When you notice that your vision is gradually worsening, you have worsening or blurry eyesight,
it's becoming more blurry.
Yes, patchy. I have a patient. So whenever she sees that she's diabetic, once she notices that her vision is blurry, she just knows that the sugar level is high.
Gone up, okay.
And that's not a very good thing. It's not a very good thing, because it means that there is damage being done. And then by the time it's now high, that's when you now want to, maybe take your drugs and start doing the right thing. After, some damages has been done. So after it becomes normal, that's what most people, they do. When it now becomes normal, they go back to the lifestyle of,
They revert.
Yes. And then when it's worse again, they go back to their medication. So those going and coming uncontrolled, increase and decrease, or chronic increase is what causes the damage in the eye, to the point that it may become irreversible. So blurry vision or patchy vision is one of the symptoms of diabetic or diabetic retinopathy. It doesn't mean if you have blurry vision you have diabetes, but it is one of the signs. So you should do it means you should not ignore the sign. You should do a comprehensive eye examination. Then if you have difficulty seeing at night, okay, it could be a sign of some damages of diabetes. Now, if you have floaters, if you notice that there are things floating in your vision, so they are called floaters. They are in the vitreous of the eye. It's a sign of diabetes damage. So those floaters could be as a result of hemorrhage, that's blood leaking into the space between.
All right.
Good evening, doctor.
Yeah, we have a call.
Oh, good evening, sir.
Yeah, welcome back.
Oh,
Rasheedat.
thank you very much, sir.
And that's our brother is calling you.
Oh, good evening, Dr.
Welcome, Elder.
Welcome back.
Thank you very much, sir.
In your speech, you made mention about Fanta,
Yes.
if I'm not mistaken.
Yes, sir.
What's the difference between the sugar level of oranges and Fanta? Because I used to, use these oranges after milk.
Okay.
I just want to know.
All right. Thank you very much for the question. Well done.
All right. Thank you for that question, sir. So,
right.
yes.
Fanta oranges.
Okay. They all contain sugar. You understand?
They're both orange in color.
Yeah. So, in fact, this one is a synthesized sugar.
Okay.
The other one is natural sugar, but they both contain sugar. All right. So, you need to watch it. In fact, I advise that if you are having diabetes, just stay clear. Most of the times, what we have the food we have, they are basically carbohydrates and all, and the body converts this to glucose, breakdown. But there are some, if you meet a dietitian, there are some basic diets. There are some special, let me call it basic, special diets that you'll be introduced to so that your sugar level is controlled properly. So alongside diets, there are medications as well that can control the sugar level. But as much as possible, you should take less carbohydrates, less, sugary things. Okay, so I had a patient came in sometime in the week, and she has been, in fact, the diabetes has seriously damaged her eyes, both eyes actually, and she's having light perception on one eye. Light perception means she cannot see anything except light. She cannot see image or anybody.
Just light.
Just light. And at that point, there's nothing that can be done. There's nothing.
Really?
Yes, there's nothing that can be done. So she had diabetes. She was even admitted because the sugar level was about 500 and something.
That's a lot.
Yes, that was caught. So it was managed. As she did cataracts because it led to diabetic cataract, just like I said earlier, and she had to do cataract surgery. Now she was managed, properly managed. The sugar level was brought down. The cataract surgery was done. She was seeing well. That's on one eye. The other eye was not yet affected. So after treatment, she went back
to her old ways. Okay, not using her medication, not eating properly, not monitoring her health, and then it became worse to the point that her body swollen, her legs swollen, tummy swollen, and the eyes, both eyes now, they are like gone. One is just having hand movements, the other one is already light perception, like I said. And at this point in time, in fact, it's just to maintain. If she's going to listen to instruction, in fact, she was the one that gave me the instruction. Stop taking fizzy drinks, stop taking sugary things, because it has affected her eye. It has affected already.
Yes, and this person is not even up to it's just in his early 40s.
Wow.
So imagine that, and you have that. You cannot do anything except God does a miracle to that eyesight.
Okay, doctor, quickly, let's just, on that note, let's just quickly take a look at the traffic situation. Ogudu Alakwere asks, it's a good one from a car wash connecting Ifako, Ogudu, NNPC filling station, Alakwere, Ojota Bridge, down to Tollgate, while from Tollgate connecting Secretariat down to Otedola in North Baja is good to go. The return journey from Otedola connecting Tollgate down to Alakwere all the way to car wash in the island is a smooth drive. That's the state of things. Of course, the Third Mainland Bridge looking very, very good. All right, back to you, doctor.
All right, thank you. So you don't need, everyone needs to go and do an eye examination. See, we are getting towards the end of 2024, and still there are some people that haven't done their eye examination. They have not done a comprehensive eye test. Yeah, probably you've been postponing it. You don't have time.
I will.
Please, before the year runs out, you need to do a comprehensive eye test, because you know why it is important to do so?
Why?
It's important because when a comprehensive eye test is done, your eyes are dilated, the back of your eyes is examined. Now, if there's going to be a problem, or if there is a problem just starting,
they can catch it on time
so that it won't get to the point of damaging or affecting your vision. Because most times when it gets to that point, it is not reversible. Now we have we categorize diabetic retinopathy into three stages. We have the background diabetic retinopathy.
Okay.
Background means,
which one is background?
Something is in the background now.
So it's not really affecting.
Yes, it has not started damaging the vision. So it's just at the background. So at that point, if you can catch it. Now, the first patient I cited earlier, is just at that background stage. Okay. So damages does not started happening yet. Now, you can maintain it. If you can keep your sugar levels normal, and that sustain your sugar level at normal, not high and low, or some people, they don't even know they have diabetes. They don't know.
And they're walking up and
They're
down.
just walking up and the damage is being done already in the eyes. By the time they are aware of it, probably it will even be too late. Then it will be pre-proliferative diabetic retinopathy.
Okay, is that
So
the next stage?
That's the next stage. So at that stage, there are some blood vessels that are already damaged. Now those blood vessels, they leak. You know, when the blood vessels break, it means there's bleeding.
Blood, yeah.
Yes, so it now they'll start. Blood will start seeping into the eyes. You know, you start seeing blood. You start seeing cotton wool spots, dots, and blood hemorrhages. Those are the things the optometrist or your doctor will see in your eyes. Now, when it gets to the proliferative stage, that's like the advanced stage. There are more blood. In fact, because there's leakage of blood and then there's low oxygen and nutrient supply to the eyes, the eye now wants to produce or make
more blood vessels.
Yes, more blood vessels. Now, in making more blood vessels, those blood vessels are tiny and fragile. So those blood vessels now leak and leak out more blood into the space between the retina and the vitreous. And as a result of that, the person can develop retinal detachment. Now, in developing retinal detachment, that's the back of your eyes already separating from the front part of your eyes, or the part of the eye attached to the brain is separating from the other part of the eye. So that's already vision loss. If it's not caught on time, if it's caught on time, it can be reattached.
Okay.
Exactly, it can be reattached. So
through surgery?
Yes, through surgery. Okay. I think I have a patient. So if she was told, okay, you have this diabetic retinopathy. It hasn't gotten to the point of retinal detachment yet. You need to take an injection. So we have injection. So she went away. She said no. She didn't want to take. People are afraid of injection. That
wasn't surgery. It was just injection.
It was just injection. So she went away. Now, in 4 years' time, when she came back, there was leakage of blood in her eyes. And then there was retinal detachment, and the vision was already affected. And at this point, she had to do surgery, and she had no choice. She had to do the surgery. So imagine if she had
should have arrested it in time.
It wouldn't have gotten to this point or that point where she had to do a retinal attachment and all. So,
Doctor, I have a question on WhatsApp. How can I prevent blindness from diabetes?
So
on WhatsApp.
Yes, prevention.
Yes.
We hammer on prevention a lot. Prevention means you are catching on time, you are doing things to avoid it. Number one is you do yearly screening. Health check, you check your sugar levels, you check your blood pressure, you check every other structures in your body. Then you do yearly diabetic screening. So we have diabetic screening. All right, where the doctor, the optometrist would do a dilated eye examination, look at your retina, check the back of your eye, and see if there are any damage being done. Now, if you are diabetic already, then it is compulsory for you to do yearly eye examination, or as often as your optometrist say, come for an eye. I have a patient that I tell, come every 3 months to
come and check your eyes.
Yes, for a retinal assessment. In fact, you are going to do an OCT scan. It's going to give us the structures. It's going to show us structure by structure the back of your eyes, what organs what structure are already affected, and every other part of your eyes. We are going to do fundus photograph. The fundus photograph will show you, okay, this is where there's hemorrhage, this is where the spot is. If your macula, that's the sharpest part of your eye, is affected, it's going to show it to you. And then we are going to advise you, okay, you need to take an injection, you need to do a surgery, or you just need to maintain your sugar level, or do your yearly eye test. So please, if you have a family history of diabetes, even if you don't have a family history of diabetes, please go for your medicals, check your sugar levels, go for your eye test, do a comprehensive eye test. It is better that, you don't have this disease than you have it, you are not aware, and then by the time you are aware, it's already too late. So prevention is better.
Prevention is
really
better. Indeed, prevention is better. So do go out there, get yourself checked. Make sure you do that, and it's better to know this and arrest it beforehand. We understand how essential eye health is for a good quality of life, and we want to ensure that no one experiences vision loss, and that's why we bring in the show week in, week out. We value your feedback on discussions covered on the show. It helps us serve you better. Please continue to share your thoughts. Feel free to visit past episodes at your convenience on our Facebook page, Lagos Traffic Radio 96.1 FM, and YouTube channel Traffic Radio 961. Search for the keywords Eyes on the Road, and remember to share while at it. Our regular optometrist on the show, who is unavoidably absent, talking about Dr. Priscilla Imade, ODMSc, PhD in Public Health, consultant optometrist at Modern Eye Care Foundation, and of course that is situated at plot 16 to 18 Ogunusi Road, opposite Omole Estate, Phase 1 by Akiode Bus Stop, Ojudubaja. And you can reach the team on 080 33 33